We want to go over to Hartford, Connecticut, though, where some frontline workers have just started receiving the vaccine there. Trevor Alt is there with them, speaking to them now. Trevor, talk to us a little bit about what's happening there.
Sure. Well, Diane, good afternoon. This is one of the, if not the first location in Connecticut to start to receive these vaccines. And what we have now here are several of these employees who are getting vaccinated right now. They can put enough for 5 people within 1 vial. So these people have been waiting patiently for us today to just kind of demonstrate how this process works. And it is very simple. I mean, it's very similar to when you would go to get a flu shot as well. This, at Hartford Hospital, they're going to be able to provide vaccine doses for 1,950 of their employees just with this first batch. And these are people who have been working very hard on the front lines. I've talked to several of these doctors receiving this, and it's hard to overstate just how excited and relieved they are with the fact that this has arrived. Multiple doctors today told me that they believe decades down the line, the creation of this vaccine with 95% effectiveness on this timeline is going to be viewed as an achievement akin to putting a person on the moon. They think that this is not only going to help us finally resolve this pandemic, but this is going to change how vaccines are created in the future as well. And as you're watching this unfold here, very simple process of sterilizing that right shoulder there. It takes less than a minute, if that, to watch all of this unfold. And Diane, it is incredibly inspiring, to tell you the truth, to watch these people who for months now have been on these front lines, justifiably first in line to get this vaccine here so that they continue doing all of the fighting that they've been doing so inspirationally for months already on hand. And so the next fight from here, Diane, is on top of walking the walk, getting the vaccine themselves, proving that it is worthwhile, that it's trustworthy. Now they have to convince the rest of the public. They all believe that they can do that. I talked to Governor Ned Lamont earlier today, and he thinks that's going to happen too. This is step 1 in what is going to be a many months long process, but we're watching those first monumental steps play out right now, Diane.
And Trevor, as you mentioned, it seems like a very quick process. We already saw 2 patients get up and be done with their vaccination just in the short time you were talking. How much hope are medical professionals getting from that aspect of it? The logistics behind the scenes are huge, but it seems like once you're there and the shot's ready, the rest of it's pretty simple.
Yeah, I mean, they're tremendously relieved, Diane. I can't say how simply enough how much they are ready to finally attack this virus head on. For so much of this pandemic, at the beginning they were playing catch up. They were kind of having to react as it was spreading all over the place. Now, at the very least, they seem to have had time to set up a plan. So even without this vaccine, they're confident in their ability to treat the virus, though it has been spreading like wildfire. This is a total game changer. And the fact that, as you have said, we're watching now how quickly they are able to sort of rifle through these vaccine administration procedures. And this is when we only have the Pfizer vaccine approved. We're still waiting on multiple vaccines to get that process. It's going to have a snowball effect as we get more vaccine doses that become available. And we're going to see all over the country, just like this, people who can finally come out, get vaccinated, get inoculated, and then hopefully we can start to see those signs of regular life that the country and the world have been waiting so patiently since the beginning of this pandemic, Diane.
So many anxious for that return to normalcy. And Trevor, what does the governor have to say about plans for the continued rollout of this vaccine as we get the other vaccines approved, but more importantly, as you try to expand this into a larger group of the population, which carries even more logistics?
Sure. Well, he's confident. I asked him so far if there were any hiccups in how the distribution process has worked so far. He said no, but it's only been about 8 hours or so. So as we get more doses, there's going to be a lot more logistics to work out. But he says that so far, the federal government has been of help in getting the vaccine distributed, and they think that it's going to continue to work. He's very happy that these frontline workers have been able to get this first. He said that they deserve to be at the front of the line, and I don't know anybody that really disagrees with him. He is excited that they're able to do this and get back to work. And then he says he too, like so many public leaders, is going to get this vaccine himself. He thinks that's important to walk the walk, but he didn't want to jump the line with all of these doctors and nurses that have been combating this virus on the front lines. He wants them to get it first, and then he's going to get it too. And he is confident that as we get more doses available, everyone who needs to get this vaccine will be able to get their hands on it.
And Trevor, I'm kind of curious, in the press conferences that we've seen, there's been 1 to, say, 5 people who get the vaccine, but of course that's a press conference. It's meant for the cameras. What you're seeing there unfold right now, is that where they intend to give the vaccines, or is this just to show the public that this is safe and there'll be a different setup to do it going forward?
Yeah, so as you can imagine, much of this is going to be happening in doctors' offices, number one, because that people deserve their privacy should they want it, and number two, it's more efficient to do it that way. This was, I think, to serve a few purposes. Number one, it's to demonstrate we have the vaccine, here's how it works. Number two, to show that our medical workers are not afraid of this vaccine. They're not telling you to get something done to yourself that they would not do to themselves. And number three, when you have media all coming in, it just wouldn't make sense with the fact that this vaccine is still, or that this virus is still around. We don't want everybody in a crowded room. And that is something that health officials and leaders are still talking about too. The vaccine is here right now. The pandemic is also still here. We still have to go through the holidays. It's going to take several months before the vast majority of people get the vaccine themselves, and we can see that return to normal. So we still have to behave like this pandemic is still going on, because it is. And then the big question, Diane, is also what we're talking about. It was interesting to see a doctor get vaccinated earlier today, and then I came up and we did the elbow bump instead of the handshake, and we kind of joked about how soon we could go back to the handshakes, and he wasn't sure that we ever would. That's going to be a big question here too, now that we see the light at the end of the tunnel, is what of these changes that we've instituted are going to stick around as people realize that maybe keeping a little bit more distance is able to keep us healthier, and wearing a mask in the winter on top of keeping you safe from COVID-19, or keeping others safe to a degree from COVID-19, also protects you from other viruses and the flu and things like that. The fact that we can even think about that and life after COVID-19 is a sign of just how far this vaccine is taking us, Diane.
It sure is, and the hope that vaccine is bringing to so many people. Trevor Altforest in Hartford, Connecticut. Thanks, Trevor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.